Up next is our last video of the day. So one other presenter that couldn't be. So I'm going to share screen and launch off Contingent Solutions, which is the architect. Let me make sure the volume is up.
Hello, my name is Jared Staub. I'm the CEO of and co-founder of Contagion Solutions, and thank you for the opportunity. I'm here to talk to you about the ARC Tent, a portable, affordable, disposable, negative pressure environment. So we live in a changed world. Globalization has led to many benefits, but it's also brought diseases to our shores and all over the world with rapid spread. We've seen this with SARS, MERS, H1N1, H3N2, swine flu, Ebola in 2014, which continues to pop up, and also with COVID. We've seen this with multiple different variants as well. So these zoonotic infections are going to continue to increase as we encroach on native habitats. And so we've got to be ready. What this means, this has taken an emotional toll and a financial toll. We've seen skyrockets in the cost of PPE. We've seen quarantines, sickened, and even lost healthcare workers. We have seen aerosol mitigation strategies that require spending anywhere from 3 minutes to an hour of OR time to allow for the CDC mandated 12 airflow exchanges. And we lack the negative pressure environments to really keep our people safe. So this has led to skyrocketing healthcare and decreased margins. And in the US, especially in a fee-for-service, this has hit our elective surgeries, hit the bottom line of many health centers, causing for cuts in pay and inability to hang on to workers as we fight this once in a 100-year pandemic. This has an emotional toll as well. We're tired of watching loved ones die alone via Zoom and family members not being able to be with their loved ones at the time of death. We've seen healthcare workers die and get sick and become maimed right next to us. And this was made in a garage when we didn't know if we could go into our houses and hug our kids. So what we offer is a portable, affordable, rapidly deployable, disposable, essentially virus vacuum or pathogen mitigation device that is able to set up in an ambulance or in a CAT scan or MRI, and the ability to do that within 30 seconds. Costly renovations to convert health system and hospital rooms and offices into negative pressure environments, and at a cost to manufacture of $20 to $40 per unit, we think that we offer a simplified solution. Many things require advanced PPE, even prior to COVID or other aerosolized pathogens. And we believe that we can become the standard of care by containing these in our rapidly deployable, affordable device. So we want to protect our frontline health workers, and that's our mission. And as we can see, we've got a very clear inflatable structure that allows for access for many procedures. This can be deployed anywhere. It ships flat, has 5-year shelf life with its components. And so we're very, very excited about that. The clarity and access to the patient is great. Even in this picture, you can see the color of the patient's eyes. So we really think we are unique in our ability to offer this environment. We're disruptive technology. We've got interest from the military, multiple growth strategies, including the dental environment, peds, veterinary, and GI, with dental being, #1 aerosolizing procedure at 550 million procedures a year, and many people have delayed that care. So we've got market interest from several major health systems, as well as distributors who are awaiting FDA approval. Our IP strategy is solid. It's with Stern, Kessler, Goldstein, and Fox out of Washington, D.C., with a non-provisional patent and PCT filed. We have a strong license agreement with KU as a partner. Our management team and scientific advisory board is great. Many from industry, Emory, Columbia, and so forth. Our EUA application has been submitted, and we are filing for 510K submission with our Class 2 device. We've got a great strategic partnership with Fitz Thor's Engineering, an FDA-certified facility that's taken many products to market. We're looking for an experienced partner. We want to make a social impact. Capital raises, we think 500 to 750 to get this done, some of which we've already raised, and we're obviously willing to negotiate equity and board representation and so forth. Our overall strategy is a strategic acquisition as our exit strategy. And we want to change the standard of care, help loved ones die with dignity, and protect our healthcare workers and first responders. This is our team of 5 co-founders, 70 years of ICU and anesthesiology experience, researchers, national speakers, and so forth. Again, talented scientific advisory board who has been crucial. So thank you again. I'm Jared Staub with Contagion Solutions, and looking forward to next steps.
Jim, you're muted.
I'm sorry. Yep. I was checking to see if Tim had joined us. So I was going to say,
I'm
we
on.
didn't have to hear the video by Jared, but Tim was able to join us if there were any questions about the ARC tent.
You bet. Thanks, Jim, for having me. Thanks, everybody, for letting us present.
Thanks for jumping in your car and, and joining us.
How small can that, like uninflated, how small is this device?
Yeah, that's a great question. So packaging, obviously very important to us. So those are just air inflatable struts. So once you take all the air out, it collapses to literally less than 2 inches thick. And it can be folded, depending on how we fold it, as big as, depending on how you want to store it, 18 inches, we can have that as well, 9. So we're really happy with the packaging and how small it will condense. And then from that packaging, you can have it literally inflated in like less than 10 seconds. So pretty excited about that option for rapid deployment. Think, like a CPR type situation or even backup ambulances.
Obviously, they're reusable, Tim?
The plan at this point, reusable in this COVID era is not something a lot of people are very excited about. So when we first came up with it, was modeled as a disposable type product. So it deflates easily. Nursing can, condense it very easily and dispose of it. However, it's a great question, especially if you're looking potentially developing nations where you're more likely to reuse products. So we're currently evaluating some of the different cleaners and disinfectants, that would be used on the plastics. So that's something we're working out with our FDA manufacturer right now to see what that would look like. So it certainly is a potential, but initially, to be honest, we thought it more of a disposable type product, which set us apart for some potential competitors who are more rigid type structures that have to be cleaned. It's more the rapid, setup and takedown type of a situation, not putting anybody at risk as well.
Then one size fits all, I presume. You can do kids, teenagers, adults.
That's correct. We did a lot of evaluating on the neck cinch point to allow for different size, obviously heads to get in, whether it's adult or pediatric. And then there's an adjustable strap to get a seal around the neck. And thankfully, with a negative pressure situation, you have to have a limited amount of air intake anyway. So you don't have to have a perfect seal every single place. You need a little air ingress. So to have a little tiny spot every once in a while on the neck is actually beneficial. So that allows us also to accommodate many different sizes.
Cool. Thank you.
Speaking
of children, does having something around somebody's neck like that, I mean, it's a medical situation, but does this stress some people out?
Yeah, that's a great question. So we haven't done any extensive, studied user survey at this point, but from the initial evaluations that we've done with different users, that hasn't been a concern, thankfully. It's a very loose fitting. Think of it like a collared shirt is kind of how it feels at this point in time. So the pediatric population will have to do some more evaluations on, but at this point, it's perfectly clear, see-through, you can hear everything. So it's been very comfortable for patients at this time.
Okay, thank you very much, Tim.